Hi, my name is Dorothy, and I'm an occupational therapist at San Joaquin Valley Rehabilitation Hospital in Fresno, California. And I'm here to present a short video on spinal cord injury education on a topic called autonomic dysreflexia. Now, autonomic dysreflexia is an episode of really high blood pressure that can happen because of the distress that's happening either in the body or to the body, like on the skin, the bone, the muscle, that type of a thing. Our spinal cord injured patients who have an injury very high in their neck or just below that area are the people that are most prone to having autonomic dysreflexia and this very high blood pressure episode. This can be a very dangerous problem because it can actually cause you to have a stroke. It can cause the retina in your eye to detach. It can cause the possibility of a heart attack. It can even cause death if it's not taken seriously and if it's not taken care of very quickly to reduce the level of the blood pressure. Now, unfortunately, people with spinal cord injury do not always feel their body the same way that we do. The messages to and from the brain are just not getting through. And so where we would feel pain with an ingrown toenail or a bladder infection or anything of that nature, it would tell us before the blood pressure went crazy. So what happens with the spinal cord patient, by the time that blood pressure is up that high, it needs immediate action to take care of it. Some of the most common things that cause this blood pressure to go up high are problems with the bladder. The bladder gets so full, it's just stretching to its limits. Could be you're sitting on the catheter tubing and it's not letting that bladder drain. Or it could just be time for that person to do their regular removal of urine from the bladder since it's not working properly on its own. The second thing would be checking the bowels. The bowels can also become very full. The body's not able to release. And so that is a very, very common cause. And the third would be any issues that would be involved with the skin. So there could be, like I had mentioned earlier, ingrown toenail, or there could be a burn or a cut, or maybe even a fractured toe or something that just wasn't picked up initially because the person didn't feel the pain of the incident or it happening. So what would be some symptoms that you're having this problem, that your blood pressure is going up? First of all, a pounding headache, the pressure in your head. That's why you could have a stroke, because the pressure becomes so great in the head. Pounding headache, blurry vision, spots in front of your eyes, nasal stuffiness. You could have goosebumps or sweating above the level where the injury was. Those are all classic signs. You have a low heart rate also. So high blood pressure, low heart rate. It's very important to know what your normal blood pressure is. People who have spinal cord injuries often have a very low running blood pressure. And so your blood pressure at 150 or 160 may not seem like a dangerous thing to any medical professional just taking your blood pressure. You have to let them know, my blood pressure is normally this. This is something happens with spinal cord injury. Please really look it up and make sure you understand. So what do you do when you're at home? This happens to you, you know it's happening. If you're laying down, sit up so that the blood pressure can kind of drop down. You want to take off any type of heavy, tight clothing items like compression stockings or abdominal binder, tight socks, tight shoes, anything tight. Release them so that the blood pressure can relax. Then immediately look for the cause. Start with the bladder, check the bowels, check the skin. If you cannot find something and relieve the pressure within a very short amount of time, you need to call and get emergency services and get to an emergency room. When you get there, make sure that you let them know what you think is happening to your body so that they can take appropriate action. So you want to make sure that you're knowledgeable and that you're prepared, you're taking care of your skin, so prevention is the best thing. You want to make sure you're taking care of your bladder, your bowel, and your skin, as well as any other areas that you would need to have concern for infection, and any of the things that we talked about previously. So be safe out there, and thank you so much for your time.